Morning, everybody. It's my pleasure to be here again this year. Today, I will share with you about how to transform our acne management to fulfill our patient needs and desire. This is the agenda for today. I think everybody knows that acne is not the right treatment, right? But the problem is it can cause permanent scarring and cause many other problems. It can reduce the self-esteem, self-confidence, cause bullying, anxiety, and even the suicidal thought. There are also many social consequences from the acne. And you can see that many of your acne patients also have the problem in their quality of life is comparable to the chronic illness like diabetes or asthma. And how can we manage the acne, right? I think most of the dermatologists around the world use this guideline suggesting from American Academy of Dermatology in 2024. You can see that they will start by assessing the patient with the severity of the acne, and you classify your acne patient to be mild, moderate, or severe. And after that, you select the treatment depending on the severity. For the mild group, you can start with the topical treatment. Moderate and severe group, you will start with topical and combine it with the oral medication, oral antibiotic, hormonal agent, isotretinoin. But you can see that the main theme of treatment for this guideline just only topical and oral treatment, right? But for the procedural treatment, they mentioned about it very few, and they said that there is no enough evidence to support the use of the procedural treatment for the acne. But in the real life, right, we do many kind of the procedural treatment, comedonal extraction, acne injection, light and laser therapy. How can we classify our patient by severity? You can use this global acne grading system, but it's quite complicated, right? So many of the doctors like to use this investigator global assessment because it's more easier. Mine is just the comedonal acne. Moderate is inflammatory acne. Severe is nodulocystic acne. The problem is in the clinical practice, when you apply this guideline, you usually find an obstacle to the effectiveness of the treatment, especially the adherence to the treatment of your patients, right? Have you ever think about how many of your patients achieve complete resolution of their acne and said that their needs were fully met? No one know about this number, right? But we really do know that we saw many patients, they're shopping around, seeking for the better treatment than they got before. Let me show you some example about this situation. This young man presented with multiple comedones on his forehead. After 4 weeks of topical treatment, his acne getting worse. It's become more inflammatory purple, pastel, and it's focused on over his face. So he was really dissatisfied about this result. Same as this man, even he taking the antibiotic for more than 3 months and switching to isotretinoin for another 2 months, he still had a problem about the new nodulocystic acne on his face. And in this case, even he was successfully treated with isotretinoin, but he's still anxious about his scar. This young lady, the problem is even she taking the oral medication, antibiotic for 2 months with topical therapy, she still has the new outbreaks of the comedonals and inflamed pimple on her face. And she was really sad about this. You can see that every time that she saw her acne, she squinted. And so she got many hyperpigmentation and many scars on her face. As you can see, there are many challenges in the acne management because variability in the clinical presentation. Many times, patients presented with a mild form of the acne, but a few weeks later, they become moderate or severe acne. And the big issue is the acne treatment often takes considerable time before visible improvement was seen. So many patients, they cannot tolerate about it. They usually expect rapid result and they stop the treatment. And the other issue that we have to be concerned is the mismatch between the clinical goal and patient priority. Why doctor more focus on the severity of the acne and the lesion count, but the patient care more about the hyperpigmentation and the scar. You can see that the guideline is classify the patient by the severity and recommend the treatment follow that severity, right? But they overlook the patient's psychosocial burden, their needs, and their expectation. And treatment regimen often not individualized for each patient, right? So they not follow with the patient lifestyle or patient preference. And you can see that to achieve the best result, it's important for us to listen to our patients, for listen to their needs, their expectation, and the treatment should be follow their preference. They are more likely to stay engaged and achieve better outcomes. This is the example from my study. Patients prevalent and adherent to acne treatment in Thailand. You can see that about 30% of Thai patients rely on only single treatment, but more than 60 to 70% they use the combination treatment between oral medication, topical treatment, procedural treatment such as comedone extraction, acne injection, over-the-counter treatment with a cosmeceutical and supplement. And more than 50% of them combination by using topical treatment or comedone extraction as their primary treatment and combine it with other options. Only 25% use oral medication as their primary treatment. If we look in detail about the current acne treatment, we find the same result. Topical treatment is the most common use, is about 68%, and followed by the comedone extraction, about 52%. Cosmeceutical is about 42%, and oral medication is the less common use for Thai people. Only 16% for oral antibiotic and 10% for isotretinoin. This result align with the treatment preference of the patients. You can see that the number one is the topical medication, and followed by cosmeceutical comedone extraction. And the least prefer for them is oral medication. And when we ask them about the factor that influence in their decision, the number one is the effectiveness, followed by the work quickly and affordable, and also the side effect. You can see that Thai people, they don't like to take the medicine. They more prefer for the topical treatment and procedural treatment, and they like to combine the treatment. And we also study about the adherence to the acne treatment of Thai people. We found that only 34% of Thai people strictly to their acne treatment. Most of them struggle with the adherence of the acne treatment. And when we look at the factor, we found that if the patient feel that the treatment result is not satisfied for them, or they feel unhappy with the medical provider communication, they are less adherent to the acne treatment. Why? If they use more than 3 types of the treatment, they usually have better adherence more than those who use only 1 or 2 types of treatments. This may be from the combination therapy, provide more faster, more effective. And the factor for skipping the acne treatment, number one is the cost, only followed by the lack of noticeable result and the side effect. So you can see that most of the patient effectiveness is number one, and how quick of the result is number two. You can see that in real life, when we apply this guideline, if they don't match with our patient preference, they are less likely to stick with their treatment. So to achieve the best result, to fulfill patient needs and design, it's very important to integrate all of these factors into a personalized treatment plan. Because you cannot just give them the treatment only on the severity of the acne. Each patient has something different. For the personalized acne management, the first thing, you have to assess them first. Not only cause and severity of the acne, but also the physical, psychological impact, their lifestyle, and their expectation. And you have to engage your patient into the decision making. Consider their preference and adapt the treatment plan to follow their lifestyle. When you select the treatment, your decision should be based on the severity, the cost, and also the legal factor of the acne. And you have to customize it with your patient daily routines. And you have to overcome all of the barriers to the adherence, because adherence is the important issue for the acne treatment. Right? You cannot treat them just only a few months. Some patients you need more than 6 months. Right? And it will be better if you can integrate the adjunctive therapy, especially for the procedural treatment, right? With the comedone extraction, acne injection, light and laser therapy. But in this process, one of the important thing that you have to consider on the time is effective communication between you and your patient. You have to provide a clear, understandable information and set the realistic expectation for your patients. After that, you have to monitor the progress, right? You have to set the efficacy and you have to manage the side effects. Many times you have to modify the plan. I saw that many dermatologists give the patient follow-up every 1 month or some every 2 months. I think it's too long to see to assess the efficacy and side effect of the treatment, right? And it's really too long for your patient too. And after finishing the acne treatment, you have to do the prophylaxis and also to promote the long-term skin health for your patient to improve their psychosocial well-being and confidence. Actually, in this step, you will be surprised that many of your patients will be more interested in the aesthetic program, such as the rejuvenation program with the energy-based device or injectable, because they are really happy with their treatment, get them more confident, right? And they touch on your expertise. I will show you the example how to apply this personalized acne management to the clinical practice. The first thing is the initial assessment. Don't forget to assess about the psychological effects, not only on the physical effect. Right? And the important issue is their goals and their expectation. And assess the lifestyle and check the adherence of your patients. Also the financial constraint that may be the issue for some patients. And for the treatment plan, you can integrate all of these information to the combination treatment for the mild form of acne. You can start with topical treatment, retinol, phenoxy peroxide, and you can combine with chemical curing, comedone extraction. For the moderate acne, you can combine topical treatment with the oral medication, antibiotic, hormonal agent, or isotretinoin in some cases. And in this group of patients, you need to do more procedural treatment, like for the acne injection in the inflamed papu, inflamed nodule, comedone extraction, like laser therapy for the acne and for the PAH and the scar. For the severe acne, nodulocystic acne, you can use the oral isotretinoin, but you have to tailor the doses for each patient because some of the patients cannot tolerate with the side effect. And you have to do the scar prevention and do the early intervention for the scar. In this stage, you can do many combination with the acne injection, comedone extraction, chemical curing, light laser, microneedling, radio frequency. All of these treatment plans should be based on shared decision making with your patients. And you have to equal consideration of the psychosocial burden along with the severity of the lesion and respect to your patient preference, lifestyle, and so think about the cost. And use procedural treatment as an adherence booster, treatment enhancers, and the scar prevention. the resolution of the acne, you have to do the prophylaxis. You can start from the topical treatment with retinol and phenoxy peroxide. But some of your patients may need more. You have to give them the isotretinoin, hormonal agent, or laser therapy. Because right now, we have the new laser system, like 1726 nanometer, that is can reduce sebum production. It can reduce sebaceous gland size. So it's a good machine that useful, very useful for acne prophylaxis. And you have to also do the psychological support for your patients. Actually, in this state, you can offer them many of the aesthetic procedures to improve their confidence and improve their beauty. Because in this state, after the resolution of the acne, they usually have more confidence of their face, and many of them would like to go to the next step to improve their beauty too. Here is the example of the patient that was treated with this personalized acne management. For this young lady, she had the problem about the acne for more than 3 months. But she wants to get the improvement in only 1 month before she had the graduation ceremony. So what we can do for her, we have to do the combination treatment, oral medication, topical medication, acne injection, povidone extraction, IPL treatment with beam laser every 2 weeks. And 4 weeks later, you can see that she get a lot improvement. Even there are some of the acne mark on her face, but she feel very happy because for this mark, she just use the concealer for her photo shooting. And next is this man. He using isotretinoin for more than 4 months. But the problem is he still had the breakout of nodulocystic acne on his jawlines. And he also worried about the scar and hyperpigmentation on his face. So it means that only the isotretinoin and topical is not enough. For the big nodulocystic acne, I combine it with the acne injection, and we do the picosecond laser toning for the hyperpigmentation, VB laser for the scar. And he feel that very satisfied about this result because it's a lot better than only taking the isotretinoin. This picture only 6 weeks after start the combined treatment. Same as this lady. This lady taking oral antibiotic for more than 2 months and also use the topical treatment. And she still have the new breakout of her acne all the times. And she don't want to take the medicine anymore. What we can do for her, we combine the treatment with the acne injection, povidone extraction, chemical peeling, IPL treatment. And this is 6 weeks later, she can stop the oral medication. She feel really happy about that. She used just only the topical treatment for her acne prophylaxis. And you can see that her scar is getting better a lot too. Same as this young lady that I showed you before. The problem is keep coming of the acne inflamed purple and povidone on her face. And she squeezed it all the time because she cannot tolerate any acne on her face. So what we can do for her, we combine the treatment with the chemical purity, uh, comedone extraction, right, and oral antibiotic. For another 1 month later, she can stop on of the medication. Use just only topical retinol for prophylaxis and for her pigmentation. And you can see that she did not squeeze her acne anymore. Right? She feel very happy about the result. And this woman, she had the hormonal acne. She usually had the breakout of the inflamed acne when she had a period, especially around her mouth. And she took the contraceptive pill for 2 years. It's getting better. But right now, she would like to get a baby and she don't want to take any medicine. So what we do for her is we collect the inflammatory acne by the injection and for the comedone by the comedone extraction combined with the topical treatment and collect the scar with the VB laser. And for her acne prophylaxis, we have only one choice for her. The laser 1726 nanometer to reduce the sebum function and sebaceous scan. 2 months later, she feels very happy. She don't need to use any medication and no new acne outbreak anymore. And this young beautiful lady, her problem is the oily skin, and she often have the breakout of the acne, leave her the leg mark and the scar. And the problem is she working as a model, so this acne problem, caused a lot of trouble in her career. And she took the isotretinoin for 1 year. It's getting better. But after she stopped it for 6 months, this problem come back again. So what we do for her, we combine the treatment for her with the picosecond laser for the hyperpigmentation, comedone extraction, topical treatment, and we also do the 1726 nanometer laser for reduce the sebum on her face and for the acne prophylaxis. 2 months later, her face getting better significantly. Her face not oily anymore. So when she make up, it's more smoother. She will feel very happy about this. She get more confident on her face. So for her, she want to go to the next step. She want to do the rejuvenation program with energy-based device and injectable to further boost her confidence and beauty. So you can see that for the effective acne management, you requires looking beyond the visible lesions, integrating clinical signs with the patient prevalence, life circumstance, and emotional well-being, make the treatment both practical and meaningful for your patients. Thank you for your attention.
If there are any questions, please feel free to ask. If there's no further question, we will now proceed to the next session. Thank you once again, Dr. Arnold. And to our last speaker for today's morning session is Dr. Risha Rasami Cho, a medical director of Masterwork Clinic in Bangkok. He has served as senior local mentor trainer for Galderma Thailand since 2018 and is a certified Windbreath trainer, sharing his expertise as an international speaker at leading conferences worldwide. Today he will be presenting on the topic PLLA-SCA, unique mechanism of action and showing the first proven regenerative biostimulator. Please join us in giving a warm round of applause to welcome Dr. Risha.
Good morning, you all. You can call me Dr. Richard for easier in English name. I think nowadays biostimulator are gaining more and more popularity in the field of aesthetic. And there's a lot of biostimulator out there in the market. But what is the difference between the original biostimulator and the regenerative one? This is the big question. What is the regenerative biostimulator? This is my disclaimer. So let's take a look for this slide. Normally, original biostimulator is associated with collagen production stimulation. Just only the collagen that we emphasize on this keyword. But when this comes to regenerative biostimulators, the meaning goes beyond that. It's about the restoration, renewal, and regrowth of lost or damaged tissue with identical but healthy or healthier. This is the important keyword of the regeneration, identical but healthier tissue. So would it be better if your regenerative biostimulator can improve all the tissue from the aging process through the trauma or any kind of pathology to be renew all the identical but healthier, like I mentioned. Let's take a look at the aging process. As we know that when we get older, our face change in many ways. From deep within, our bone structure alter, we lose volume, our tissue shift, or we call tissue displacement, and last but not least is the skin quality as well. When I'm talking about the skin quality, you know that when we age, the aging process affects all the three layers of the skin: epidermis, dermis, and also hypodermis. So if we talk about regenerative biostimulator, it's really important that in that kind of biostimulator should focus all of the aspects in every layer of the skin pathology: epidermis, dermis, and also hypodermis. So nowadays we have a clinical study, both histological, clinical validation, and genetic pathway analysis that proven regenerative biostimulator like PLLA, SCA, or specific for Sculptra as this kind of can correct this kind of issue. Let's take a look at the mechanism of action. When you place the PLLA, SCA in the skin, the first thing that will occur is the immune response will be triggered through an important key cell that is the macrophage. The macrophage will be triggered and shift into the M2 polarization, or we call regenerative phenotype. This is really important because it will decide what pathway that the process will go, inflammation or regeneration. And after that, the senescent fibroblasts will be reactivated, migrate, and proliferate. But not that all. Like I mentioned, the original or basically biostimulator will be associated with just only the collagen production. But if we talk about regenerative biostimulator, it should cover much more element in the extracellular matrix. We have found that from PLLA-SCA, they can trigger other elements like elastin, proteoglycan, laminin, integrin, and much more like collagen type 3, type 4, and type 6. So this is really important. And like I mentioned about the hypodermis, Recent studies have demonstrated that Sculptra or PLASCA can stimulate the adipogenesis as well. So this is really important when it comes to the routine practice because we have to decide what kind of technique of injection that we need to deliver the outcome to the patient according to the mechanism of action. Let's take a look. Last year, there are at least 5 clinical studies that prove my word about the regenerative properties. So this is the thing that I can say that PLASCA is the first in the world that have a clinical, histological, and genetic pathway analysis proven. This is their first proven regenerative one. And at least one paper this year in January about the genetic pathway analysis. I will not go in detail for that. Let's take a look at their strategic use. To my own practice, PRASA, I have some tips and tricks for you all for today. The clinical pro for lifting and controlling. The first thing, whenever I want a visible neocollagenesis, I will put the product in very, very superficial plane, like in subdermal injection. But whenever I want just only to stimulate the adipogenesis or give the structural support, I will go a little bit deeper in the subcutaneous layer. You may confuse that subcutaneous and subdermal are in the same layer. It's result leading to very different outcomes. The third one is select key placement zone that can influence the lifting outcome. I will come with a mapping of the treatment area that I will show you later. And last but not least is the precise allocation of dosage per area, which plays a key role in the treatment efficacy. So all the thing that I want to conclude for this part is the matter of plan. Let's take a look at the difference between the subdermal injection and the subcutaneous injection. You can see a difference in terms of when we insert the cannula in the skin. Let's take a look at this case, a 40 years old lady. You can see that when we do the facial examination, moderate degree in terms of loss of firmness, skin sagging, and volume loss. And she complained to me that she don't want to get HA filler treatment because she want to still look natural and don't want to get too much volumization. So I think this is a good candidate to start the treatment with Sculptra, the PLASCA. So I give her a 3 session of PLASCA, 1 vial per session, 1 per 3 sessions in a 6 week apart. You can see from the mapping that I intentionally skip the zygomatic area because I don't want to widening her face anymore. But I go in an L-shaped pattern in the temple area, just below the subzygomatic area a little bit, and in the middle cheek in order to give her structural support. So I go in the subcutaneous layer, like I mentioned. Let's take a look at the result. And 6 months later, you can see her temple get increased in dermal thickness, skin thickness, and in the hollow cheek as well, but not too much when compared to HA filler. But I think it look more harmonious and smooth in contour, and she loved the result, and accordingly leading to a lifted area at the jaw as well. So just only inject in an L-shaped pattern the temple, skip the zygoma for this cat, just below the zygoma and in the middle area. You can see the effect in the lower part as well. So this is one treatment protocol. Emphasize one again, I go in the subcutaneous injection plan for this. Let's take a look in the, on the other hand case. I think this is really tricky, very difficult to treat with the injectable. You may see that, oh, when I have found this kind of lady, I will go with the energy-fed device. It's okay because she looks shabby. I don't want to add any more volume to the case like this. But you know what? If you go with the energy-fed device, The best duration that we can get from that kind of energy-based device maybe 1 year. And after that, she may lose some fat if we use too much or too high intensity of the energy from energy-based device. When she lose the fat over here in the lateral part, so it leading to a more sagging or worsening this kind of problem. So would it be better if we use some kind of regenerative biostimulator before and then combine with energy-based device later? Let's take do the facial assessment first. You can see that she got a very severe degree in loss of firmness, which we have to take the physical examination by the skin snap test, and moderate degree in skin sagging, but mild volume loss. So this is really important, a good candidate for sculpture, but in a slimming lift protocol. So I give her a 3 session of PLLA and CA, 2 and 2 vial in 6 weeks apart. You can see the area of injection that I emphasize just only in the lateral to the line of ligament, because you know that the fiber arrangement is different between the medial part and lateral part, especially in the lateral to the line of ligaments, that the fiber arrangement arranged in parallel. So whenever you put the product here, it will help in lifting capacity. Let's take a look at the result. This is the baseline, 2 months after and 6 months after. You can appreciate a more defined jawline and lifted appearance. Her skin looks tighter and firmer as well. So this is just only 6 months, and as you can see that she loved the result when compared to energy-based device. But it's for sure, if you want to combine the energy-based device, after this, it will help to enhance or increase the result from the lifting effect as well, and can enhance the duration of the result, because just only the sculpture or regenerative biostimulator from the clinical study, the result can last up to 2 years or maybe 3 years in some patients. So I think this is a good candidate for a slimming lift protocol. Once again, emphasize, if I want to get this kind of result, we have to go very, very superficial in the subdermal injection, because I have mentioned about the adipogenesis. If I go in the subcutaneous, directly in the fat cell, which I don't want to add any more volume in the case, so we have to go very superficial. And you can notice appreciate the skin sagginess or skin firmness has significantly improved as well. So it's not just one plane you inject, not only subcutaneous or subdermal, but it's where as well. Let's take a look at the treatment profile. I have shown you the 2 profiles, the filling lift and slimming lift. Let's take a look at the filling lift. It's according to the L-shaped pattern backed by science, that we have a clinical study that have demonstrated that if you put the product in the L-shaped pattern in the temple, the zygomatic area, and middle sheath area, you can in the subcutaneous layer, you can enhance the structural support and give some adipogenesis as well. So you can take a photo of this mapping. This is the filling lift protocol. The second one is the slimming lift. On the other hand, if you don't want to add any more volume to the cast, but just want her to make her look slimmer, so go with the lateral to the line of ligaments, like I mentioned about the fiber arrangement, which is different from the medial and lateral. And once again, go in the subdermal plane to deliver this kind of result. The last but not least, the last case are different age, but the same principle. You can see that this 55 years old lady, she never get any treatment before in her life, and she complained about she looked older than her real age. So let's take a look at the facial assessment. A lot to do. She got a severe degree in loss of firmness, skin sagging for sure, and also the imbalance proportion. So what should be the first priority when it comes to the treatment plan? Some of you may think that, oh, it would be better with the filler because you got a severe loss of imbalance proportion, like rule of third, maybe not disproportion rule of third because she got a short chin, or maybe a OG curve, she lose her mid-cheek projection. So HA filler should be one of the priority that we should take and into consideration. But when it comes to my personal practice, I think most of the time this kind of patients, I will approach from the outside in. I will treat the skin quality first. You know what? If her skin quality is improved, we can reduce the dosage of the HA filler and prevent from their facial overfill syndrome because she got a mild, volume loss. So I don't want to add a more volume in this case. So would it be better if we start with the skin quality from the outside in? Let's take a look at the treatment plan. So I put her in a slimming lift protocol with the scalp drop, 3 sessions, 2, and 1 viral in the 6 week apart. You can see that I put the product in the lateral area, lateral to the line of ligaments, plus one more area in the just above the sagging jaw over here. Because I think that if we can increase the skin adherence or lifting capacity just above the jaw, so we can reduce the sagging jaw over there. Let's take a look at the result. This is the progressive transformation of the result. In the frontal view, you can see that when compared to 20 months after the treatment without any more touch-up or any other treatment, you can appreciate the skin quality. The sagging jaw get much better. But of course, she still look grumpy, so I think PLLA-SCA cannot fix this issue. So keep it in mind that how can we do to make her look more happy. The second view is the oblique view. 2 months after the treatment, you can appreciate the sagging, the marionette line completely gone. So I think this lifting effect start to occur. But when it's come to 20 months later, even more clearer, you can appreciate a more defined jawline. The sagging jaw get much better, and the skin quality as well. But again, I cannot treat her OG curve. She still lack the mid-cheek projection. So keep it in mind. And let's take a look at the profile view. You can see that in 20 months after her sagging jaw gets much better, I can improve her jawline to be more defined jawline. But about the wrinkle lines, yet there's remain disproportion when assessed by the wrinkle line. So there's a lot of things to do. So from now on, you can see that PLLA-SCA provide long-lasting benefit that patient and healthcare practitioner can see and feel. So what is the secret that the result can last too long, up to 20 months or maybe 2 years or 3 years in some patients? It's about the adipogenesis. Recently, we have a clinical study have demonstrated that PLLA-SCA can stimulate the adipogenesis. And what is important about the fat cell? Do we need fat cell? Yes, of course, because like I mentioned about the aging process, we age in every layer of the skin, epidermis, dermis, and also hypodermis. So we lose fat cell. If we can improve the fat cell, especially the good one, the small fat cell, like dermal white adipose tissue, it can have the effect or interplay together between the dermal white adipose tissue and the fibroblast, because the fat cell can secrete the adipokine. One of the important adipokine is like adiponectin that can stimulate the fibroblast to stimulate the proliferations. So we can get more collagen from adipogenesis with this kind of regenerative biostimulator. From the gene pathway analysis, we have found that at least 17 genes were significantly upregulated and associated with the treatment of sculpture. But from these, we have 8 genes that related to adipogenesis as well. So this is really important and can answer some of the questions that we know that sculpture can treat lipoatrophy in HIV patients very long time. But what is the reason behind that? Why we can improve the volume in that kind of patients? Because adipogenesis, this is the secret of the gene that we have found last year. So back to my case, when we do the follow-up, we look at the facial assessment once again. You can see the improvement in terms of loss of firmness and sagging from just only biostimulator. But of course, we still have the problem about the imbalance proportion. So from now on, is the role of HA filler injection. In this case, I have planned 3 sessions. The first session, I will focus on the mid-cheek in order to correct the disproportion of OG curve. So I put the filler in the cheek apex, the middle cheek fat, and piriform fossa. In the second step, I focus in the balance profile in order to lengthen her chin, give her chin more projected. So I correct her chin, her pre-jaw sulcus, and the marionette lines. And last but not least, in order to, after we correct her frame, facial frame around the mouth, so we go directly in the lips area in order to make her look younger and much more attractive. So let's take a look at the result. This is the before and after. You can see that I can improve her proportion, especially the rule of third, the horizontal third, because I can lengthen her chin, but just to make her look natural. In the oblique rear, you can see that the OG curve gets much better when we treat with the HA filler. So when it's come to the 20-month result from the before, when she was 55-year-old and now she is 57-year-old, you can see that she looks happier. From the profile view, I can increase the chin projection with the HA filler. You can see from the Gardner chin retrusion scale over there. And of course, the liquid lines as well, because we can make her lips relation to the tip of the nose and the proconium was much better. So finally, I think you can see that the role of the regenerative biostimulator helped me to reduce the dose of the filler injection as well, and we can improve the skin quality, enhance the durations of the effect, instead of just only the HA filler alone. From now on, you can add or combine the energy-based device to just maintain the result. We don't need to do this kind of protocol every year because like you can see that durations of effect from the regenerative biostimulator can last really long. My key message to give you takeaway is that all regenerative biostimulators are biostimulatory. I mean that it can improve in collagen neocollagenesis, but not all biostimulators are truly regenerative. So when the next treatment you will decide to use what product you will use, let's take a look for the information or any clinical data that's proven that biostimulator are truly regenerative. It will help you to treat your patients beautifully, correctly, and with safety and efficacy as well. Thank you.
For your presentations. Are there any questions from the audience? Thank you once again, Dr. Richard. So, ladies and gentlemen, this concludes our morning session. On behalf of the organizing committee, I would like to sincerely thank you all our distinguished speakers for sharing their knowledge and expertise. We now invite you to the lunch symposium. Please check the program booklet for any topic of your interest and proceed to the corresponding
Saan kayo pupunta namin?
And don't forget
Magagala na kayo?
our
Pupunta muna ako sa senior.